Can pelvic floor dysfunction cause prostatitis symptoms? Imagine feeling constant pressure or discomfort in your pelvic area and wondering if it's your prostate acting up. Sometimes, what seems like prostatitis might actually be caused by issues with your pelvic floor muscles. Pelvic floor dysfunction happens when these muscles become overly tight, spasm, or don't work together properly. These muscles support your pelvic organs, including the prostate, bladder, and rectum. When they are tense or unable to relax, they can cause symptoms that look just like prostatitis. Prostatitis is an inflammation of the prostate gland, often caused by infection. But most cases, especially those that last a long time, are not caused by bacteria. These are called chronic pelvic pain syndromes. In many of these cases, the real issue isn't infection but muscle dysfunction in the pelvic area. When the pelvic floor muscles are in spasm or are too tense, they can press on the prostate and surrounding tissues, leading to pain, urinary problems, and discomfort during or after ejaculation. Symptoms that overlap between pelvic floor dysfunction and prostatitis include a frequent urge to urinate, difficulty starting urination, weak or interrupted urine flow, and pain during urination. Sexual symptoms like pain during or after ejaculation, erectile issues, or discomfort during intimacy are also common. You might feel pain in your testicles, groin, lower back, or even in the rectal area. Some men experience a dull ache or pressure in the pelvic region, which can be mistaken for prostate problems. Because these symptoms are so similar, it's easy to misdiagnose pelvic floor dysfunction as prostatitis. This can lead to unnecessary antibiotic use, which doesn't address the real cause. Proper diagnosis involves a detailed review of symptoms, a physical exam that assesses muscle tone and spasms in the pelvic area, and sometimes a rectal exam. It's important to differentiate between infection and muscular causes to get the right treatment. When it comes to managing these symptoms, pelvic floor physical therapy is a key approach. This therapy helps relax and retrain the pelvic muscles, reducing spasms and restoring normal function. Techniques like biofeedback and targeted exercises teach men how to control and relax their pelvic muscles, often leading to significant relief over several months. Lifestyle adjustments such as stress management, avoiding bladder irritants, and practicing gentle stretching can also support recovery. Understanding the role of pelvic floor dysfunction is especially important for prostate health. Sometimes, what appears to be prostate inflammation or infection might actually be muscular in origin. Accurate diagnosis ensures that men receive the most effective treatment, focusing on muscle relaxation and function rather than unnecessary medications or procedures. In summary, pelvic floor dysfunction can indeed cause symptoms that closely resemble prostatitis. Recognizing this connection and seeking appropriate treatment like pelvic floor physical therapy can make a big difference. If you experience pelvic or urinary symptoms, it's always best to consult a healthcare professional who can evaluate your specific situation and guide you toward the right approach for relief and long-term health.